We all want the same thing when it comes to our healthcare: high-quality providers and fair pricing. Your employer cares about you and knows it's important that you have valuable healthcare. By offering employee benefits through a self-funded health plan, you have the ability to play an active role in your overall healthcare costs. Reference-based pricing is one way your health plan ensures fair prices for medical services. The reference your plan uses to determine the amount that will be paid to the provider is based on a percentage above the provider's Medicare rate. Some plans use reference-based pricing exclusively by replacing the Preferred Provider Organization, or PPO network. Other plans use reference-based pricing only for out-of-network claims. With reference-based pricing, you may choose any doctor, facility, or medical provider regardless of their PPO network participation. Reference-based pricing offers the ultimate member flexibility and provider choice. Let me explain. Under a traditional health plan, providers and facilities charge a set rate and then negotiate discounts with insurance companies and PPO networks. This makes it very difficult to predict healthcare costs because prices can vary dramatically from facility to facility. The price for the same medical procedure can vary by hundreds and even thousands of dollars from one hospital to another. Just as an example, the cost of an MRI can range between $375 and $2,850, depending on the facility you go to. Knee replacement surgery can vary between $18,000 to $70,000. These differences in pricing can even be seen in the same town, just at different facilities. Rather than relying on those unknowable prices and discounts of an unverifiable amount, plans using reference-based pricing match provider charges to a standard reference, usually what Medicare pays for the same services. Medicare prices are used as the reference point because Medicare is a well-established, published, and reliable benchmark for costs. Medicare pricing takes into account the provider's actual cost to deliver care, their geographic location, and the demographics of the population in that area. Medicare is also the largest payer of claims in the country, so providers and facilities are familiar with their pricing. Reference-based pricing plans generally pay physicians and hospitals at values ranging from 120 to 200% of the Medicare rate. This means the reference-based pricing pays providers at least the same amount they would generally be paid by Medicare Plus Extra. In some cases, the physician payment under reference-based pricing is higher than the healthcare providers would be paid from insurance networks on traditional plans. The overwhelming majority of providers understand and accept reference-based pricing. However, there are times when a provider bills a higher amount for the service than what your plan has agreed to pay. In this case, a balanced bill is generated for the difference. Remember, you are responsible to pay your deductible, copay, or co-insurance. These are not considered a balanced bill. However, if you receive a balanced bill in an amount greater than your patient responsibility, contact the Kempton Care Advocates at 800-324-9396, and we will walk you through your next steps. Reference-based pricing pulls open the curtain of unknown prices to educate and empower both providers and patients as they carry the same point of reference, a knowable and publicly available price. You know the cost of your care before you receive a bill. Plus, you have more provider choice and can be confident knowing that you are paying a reasonable rate for your care. The secret to spending less on healthcare is to spend less on healthcare. Reference-based pricing provides a tool for self-funded health plans and their members to expand access to care while paying less. We're here to help. If you have questions about your benefits plan, claims payments under reference-based pricing, or to learn any tips to become a better healthcare shopper, contact the Kempton Care Advocates at 800-324-9396.